Hi, my name is Dr. Ray Butts, and I'm a physical therapist at Symmetry Physical Therapy in downtown Miami. We are a concierge physical therapy practice that provides one-on-one treatment by a doctor of physical therapy without the help of aides, techs, and students. In the last 15 plus years of clinical practice, I have seen a lot of patients that suffer from headaches. But I will tell you that these are the most rewarding patients that I see because according to the literature, it doesn't matter how chronic the headaches are, how much they hurt when you have them, the number of headaches that you have in a given week, or the duration of headaches when you have them. According to research, every single one of those variables makes it more likely that I can help conservatively as a physical therapist as opposed to not. I want you to appreciate that there are three main classifications of headaches. I also want you to understand that there is a significant overlap in the physiology of these headache types. And the reason why I want you to understand is so that you can appreciate how I might be able to help in clinical practice. The three main classifications are cervicogenic headaches, migraines, and tension-type headaches. Cervicogenic headaches are up and over right-sided or up and over left-sided headaches that do not change sides within the same headache. They're typically associated with pain or problems on the back of the head and the neck to the point where if you palpate these areas or touch them or if you move them, it reproduces the familiar symptoms associated with the headache. As a result, these patients don't move these parts of the body and they end up with a limited cervical range of motion. Check out the characteristics of cervicogenic headaches. Increase in sedentary lifestyle, no effect or lesser effect of migraine meds, and nausea, photophobia, dizziness, blurred vision, swallowing difficulty, and periocular edema. These characteristics or symptoms are interesting because they directly match migraine headaches. Note that migraine headaches can be with or without aura, but they are also unilateral headaches. They have the same characteristics as cervicogenic headaches. Now, the intensity might be different, the prevalence might be different, but in the main, cervicogenic headaches and migraines have very, very similar symptoms and characteristics. The one that is different is tension-type headaches. Bilateral head pain, mild or moderate intensity, not aggravated by or causing avoidance of routine physical activity, no nausea or vomiting. Yes, there can be photophobia or phonophobia, but not both, and these headaches are not attributed to another disorder. How do we get there? Check out the mechanism or the physiology of cervicogenic headaches. Any problem that you have, back of the head or neck, doesn't matter whether it's muscles, tendons, ligaments, intervertebral discs, facet joints, all of that pain information floods into the spine and comes into the central nervous system at C1, C2, C3. And we know that the neurons that receive that pain information overlap with the trigeminal nerve. The trigeminal nerve is responsible for two things, sensation of the face and the chewing muscles or muscles of mastication. So it seems that the central nervous system interprets a lot of that pain information as coming from the neck, but some of it gets confused. And it gets confused as trigeminal pain, which is reproduced as this up and over headache, which affects the frontal area, the temporal area, the deep pressure behind the eye, the sinuses, the TMJ itself, even some ear pain, all characteristics that are often familiar in cervicogenic headaches. Here's the most interesting part. If we look at the physiology of migraines, sometimes they blame the cortex, sometimes they blame the brainstem. Doesn't matter who you want to blame for a migraine headache. The only way that you get to migraines is through the very same trigeminal cervical nucleus, or the nerves that are responsible for the trigeminal nerve. And oh, by the way, tension-type headaches, same thing. Headaches that are caused by stress, anxiety, a lot of psychosocial factors. It's true, but the only way that you get to tension-type headaches is via the trigeminal nerves in the trigeminal cervical nucleus. So here's the point. If I can treat the structures with electric dry needling, manipulation and mobilization, wind back to car therapy, soft tissue mobilization, myofascial release, graded exercise, if I can treat all of the structures via all of these tools that are responsible for delivering pain to the central nervous system, and I can desensitize the neurons that live at C1, C2, C3, and in turn desensitize the trigeminal nerve, I should be able to justify treating all three major headache types. If you suffer from these headache types, please come and see me and let me show you that I can treat them at Symmetry Physical Therapy.